All right, welcome back to Arthritis Broadcast Network's 8th annual CR Arthritis Facebook and Twitter event. My name is Ellen and I am the programs coordinator at Arthritis Consumer Experts. Today we are joined by Dr. Nadia Luca, who is a pediatric rheumatologist and clinical associate professor at the University of Calgary. She also co-leads the multidisciplinary Localized Scleroderma clinic at the Children's Hospital and conducts important research on health outcomes in children and youth with rheumatic diseases. So welcome, Dr. Luca. We are so honored to have you today.
Oh, thank you for having me.
Dr. Luca, really, as someone who wears so many different hats and has done so much, what led you to pediatric rheumatology, and why the interest in measuring health outcomes?
Yeah, thanks for the question. I think when I started on my medical career, I always knew I wanted to do pediatrics. And then I got exposure to pediatric rheumatology and adult rheumatology pretty early in my medical school electives and such. So that sparked my interest. And then as I carried on through residency, I became more and more sure that rheumatology was for me. I think what draws me to it is the long relationship that we have with patients as they do have chronic diseases. And we really get to know them and their families very well. The fact that there are so many effective therapies for rheumatic conditions, and we get to see our youth really flourish and achieve their potential. And that many rheumatologic conditions are very systemic in nature. So, as much as we focus on joints for a lot of our time, we also don't lose our skill set in the management of other organ systems and the evaluation of those. So for all those reasons, I find it extremely rewarding and satisfying career.
Amazing.
As far as health outcomes, I did do a master's degree as part of my training in clinical epidemiology and health services research. And the focus of my master's was really on how to best measure specific health outcomes. So really the science behind measurement and how to ensure that it's a valid measure, it's a reliable measure, and that it can measure change over time. Because really, if we want to improve outcomes, the first step is being able to appropriately and accurately measure those outcomes.
I couldn't agree more. And in your practice, what kind of challenges do you face in measuring health outcomes, especially in a pediatric population?
Yeah, so I think one of the biggest challenges we face collectively in pediatric rheumatology is that we deal with rare diseases. And so all of what we just talked about in terms of validating measures and then using them to study the health outcomes can only be possible if we're able to collaborate with other centers. For example, the population that I see, the localized scleroderma population, it's extremely rare. And so we definitely have relationships with other centers across North America to be able to get meaningful data and learn from our collective patient populations.
Definitely understand that. But it sounds like, there is like a multidisciplinary team involved and so much support.
Mm-hmm.
And can you give us an overview of the workshop that you'll be leading and what exactly is scleroderma?
Okay, sure. Yeah, I'm leading a workshop along with one of the pediatric dermatologists in Calgary, Dr. Vimal Prajapati. He and I run a combined clinic for patients with localized scleroderma, as well as systemic scleroderma and other conditions that have overlap between skin and rheumatic conditions. So the focus of our workshop is to delve deeply into the presentation of localized scleroderma specifically, and then to discuss various conditions that could mimic it and how to distinguish those to help diagnostically. And then the second part really is to focus on the latest updates on the treatment of this condition. So that's going to be the workshop. And for our viewers, perhaps one important thing to note is that localized scleroderma is quite different than systemic scleroderma in that it typically involves the skin. It can involve the joints as well as some other organ systems, but it's not the same type of systemic sclerosis, i.e., lung fibrosis or heart involvement or kidney involvement that we would see in patients with systemic scleroderma. So they are distinct conditions, although the skin itself could look similar under a microscope. I don't know if that makes, yeah.
And like you said before, it is so interesting that because of the systemic nature that you really don't know how it will manifest in each person. So I can imagine that each treatment is so individualized, but when you're able to start that early intervention at a young age, how beautiful and, like you said, rewarding that must be.
Yeah, for sure. And I mean, we're dealing with growing and developing kiddos. So we're really in tune with the fact that we have to halt the progression of their disease. Otherwise, they risk having significant growth disturbances or asymmetries, leg length differences, and things like that aren't quite as much of a risk if you're already fully grown as an adult.
I'm very grateful to all the pediatric rheumatologists out there from a personal point of view. So thank you for your work.
Oh, you're welcome.
And our next question is, as a specialist, how do you promote and support this concept of wellness with your patients within their families as well?
Yeah, that's a great question because it's unbelievably important. And we are lucky in pediatrics that we have a little extra time or more time to spend with our patients and their families. And as I said, get to know them really well over time. I certainly like to touch on many aspects of wellness. For example, critical things like making sure there's some physical activity or exercise that they're able to engage in and sort of troubleshoot if they need support with that. Sleep is another really big issue that comes up often. And so, certainly that's a topic of conversation. And if their disease is impacting their sleep, then we definitely address that. And then mental health has come up, especially over the last 2 years, as a huge issue. And it's something we ask about regularly and provide support for if needed through either psychology or other services. So I always encourage that kind of open discussion, and I want to know how my patients are doing from all those perspectives, because at the end of the day, we know we have good evidence to suggest that if your wellness is not good, then your disease outcomes are also worse. So it all goes hand in hand. I also really strongly promote having a family doctor or a primary care provider involved, and the patient being attached to that sort of medical home as well, because there are so many other general health things that we don't have time for in our specialist clinic.
I think that's truly incredible that you're able to touch on so many of the things that I guess aren't traditionally captured in measurement, but are, like you said, so important to those health outcomes. Our last question is, so for this year's meeting theme of diversity, equity, and inclusion, what do you think healthcare system providers, patients, we can do to kind of incorporate these concepts in our daily lives?
Yeah, that's amazing. And I really, really like that this is the theme for this year. One thing particular, perhaps to the workshop that we're presenting and the work that I do, is around medical education and ensuring that we represent all, varying ethnicities in our medical education, as far as the way perhaps skin changes might look depending on skin color is obviously very different, and that needs to be very kind of consciously taught to students. because we certainly have kind of the role of reflecting what they're going to see in their practice and ensuring that they can provide the best care to everyone. Other than that, I think in medical education as well, there's been a lot of work on ensuring that people look at their biases and are trained in first, like becoming aware of those things, and then also how to minimize them. So for example, I'm working on the residency application review right now for pediatrics here in Calgary, and we have to do a 45-minute training of how to ensure that biases are minimized when we go through that process. So I think it really is happening at all levels in healthcare, and it's finally time, to do that. And I think we'll just see it more and more. And I'm really glad that this is something that's being highlighted at the CRA this year.
I think those soft skills, it doesn't matter what profession you're in, whether it's healthcare or outside of healthcare. I'm also on the totally same page of, I'm really happy to see that being under the spotlight this year.
Mm-hmm.
Well, with that, Dr. Luca, I do want to thank you for your time. I know you're extremely busy, and for our audience, thank you. For everyone else, please stay tuned. Thank you. Bye, everyone.